What is phlegm? Phlegm, that sticky, sometimes bothersome substance we cough up, is more than just an annoyance. It plays a crucial role in our body's defense system. Composed primarily of water, mucus also contains proteins, antibodies, and other immune cells. Its presence signifies our body's active fight against infections, irritants, and allergens. When we're healthy, phlegm production remains at a healthy minimum, flowing almost unnoticed down the back of our throats. This continuous process, known as mucociliary clearance, helps remove trapped particles and microbes, keeping our airways clear. However, certain triggers can disrupt this balance, leading to excessive phlegm production and discomfort. Phlegm, often perceived as a nuisance, is actually a vital component of our immune system. It acts as a protective barrier, trapping and neutralizing foreign invaders like bacteria, viruses, and allergens. This sticky substance contains antibodies and enzymes specifically designed to fight off these intruders, preventing them from reaching deeper into our respiratory system. Imagine phlegm as a sticky trap set up in our airways. When we breathe in air laden with potential threats, these particles get caught in the mucus lining. This prevents them from reaching our lungs, where they could cause infection or irritation. The trapped particles are then either coughed up or swallowed, effectively removing them from our system. The color and consistency of phlegm can provide valuable insights into our health. Clear or white phlegm is generally considered normal, indicating a healthy respiratory system. However, changes in color, such as yellow or green, can signal an infection. Yellow or green phlegm suggests the presence of white blood cells rushing to fight off the infection. While concerning, it's a positive sign that our immune system is actively battling the invaders. However, if the color change persists for an extended period, or is accompanied by other symptoms like fever or difficulty breathing, it's essential to seek medical advice. Common culprits. Identifying phlegm triggers. Understanding the triggers behind excessive phlegm production is crucial for effective management. As we've established, infections and allergies are common culprits, but several other factors can contribute to this issue. Identifying these triggers allows us to make informed decisions about lifestyle changes and treatment options. Certain foods can also contribute to phlegm buildup. Dairy products, for example, are known to increase mucus production in some individuals. This is because dairy contains specific proteins that can stimulate mucus glands in the respiratory tract. Environmental irritants like smoke, fumes, and dust can also irritate the airways, leading to increased phlegm production. Exposure to these irritants triggers inflammation and stimulates mucus glands as a protective mechanism. Underlying medical conditions such as GERD, gastroesophageal reflux disease, can also contribute to phlegm buildup. In GERD, stomach acid backs up into the esophagus, irritating the throat and triggering mucus production. Identifying these less obvious triggers is essential for developing a comprehensive approach to phlegm management. Hydrate for health. Water's role in phlegm control. Staying adequately hydrated is paramount when it comes to managing phlegm. Water acts as a natural lubricant, thinning the mucus and making it easier to expel. When we're dehydrated, our mucus thickens, making it more difficult for the cilia, tiny hair-like structures lining our airways, to clear it effectively. Think of it this way. Thick, sticky phlegm is like trying to move a heavy piece of furniture across a carpeted floor. It requires more effort and is more likely to get stuck. Thin, watery mucus, on the other hand, is like gliding that same furniture piece across a smooth, polished floor. Drinking plenty of fluids throughout the day helps maintain the optimal consistency of mucus, allowing it to flow freely and be cleared more easily. Warm water, in particular, can be especially soothing and effective in loosening phlegm. Aim to drink at least 8 glasses of water per day, and consider increasing your intake if you're experiencing excessive phlegm. Herbal teas, broths, and soups also contribute to your fluid intake and can provide additional benefits like soothing the throat and providing antioxidants. Section 5. Harnessing humidity, steam inhalation for relief. Steam inhalation is a time-tested, readily available remedy for loosening phlegm and relieving congestion. The warm, moist air helps to thin the mucus, making it easier to cough up and clear the airways. This simple technique can provide significant relief, especially when dealing with colds, the flu, or sinus infections. To practice steam inhalation, fill a large bowl or basin with hot water. Carefully lean over the bowl, keeping your face a safe distance from the hot water to avoid burns. Drape a towel over your head and the bowl, creating a tent-like structure to trap the steam. Inhale the warm, moist air deeply for 5 to 10 minutes, taking breaks as needed. You can enhance the effectiveness of steam inhalation by adding a few drops of essential oils like eucalyptus or peppermint oil. Eucalyptus oil, in particular, is known for its decongestant properties, helping to open up the airways and facilitate mucus clearance. Remember to exercise caution when using essential oils, as some individuals may be sensitive to them. Always dilute essential oils in a carrier oil or use them sparingly. Section 6. Nature's expectorant, saltwater gargles. Gargling with warm salt water is a simple yet effective home remedy for reducing phlegm and soothing irritated throats. Salt water acts as a natural expectorant, helping to thin the mucus and make it easier to cough up. It also helps to draw out excess fluid in the tissues lining the throat, reducing inflammation and discomfort. To prepare a saltwater gargle, mix 1/4 to 1/2 teaspoon of salt in a cup of warm water. Stir until the salt dissolves completely. Take a sip of the solution, tilt your head back, and gargle for 30 to 60 seconds, ensuring the solution reaches the back of your throat. Avoid swallowing the salt water, as it can dehydrate you. Spit out the solution and repeat the process 2 to 3 times a day, as needed. Saltwater gargles are generally safe for adults and children over the age of 6. However, younger children may not be able to gargle effectively and could accidentally swallow the salt water. If you're unsure whether saltwater gargles are appropriate for you or your child, consult with your doctor. Section 7. Dietary allies, foods that combat phlegm. Certain foods can act as allies in the fight against phlegm, helping to thin the mucus and boost our immune system. Incorporating these foods into our diet can contribute to overall respiratory health and reduce the likelihood of excessive phlegm buildup. Fruits rich in vitamin C, like oranges, grapefruits, lemons, and strawberries, are potent antioxidants that support immune function. Vitamin C helps to strengthen the body's defenses against infections that can lead to phlegm production. Spicy foods containing capsaicin, such as chili peppers, jalapenos, and cayenne pepper, can help to temporarily thin the mucus and provide relief from congestion. Capsaicin works by stimulating blood flow and increasing mucus secretions, which can help to flush out irritants and loosen phlegm. Ginger, a versatile root with anti-inflammatory properties, can help to soothe the throat and reduce phlegm production. It can be consumed in various forms, such as ginger tea, ginger ale, or added to stir-fries and soups. Section 8. Lifestyle adjustments, tips for prevention. Beyond addressing immediate phlegm buildup, adopting certain lifestyle adjustments can significantly contribute to long-term respiratory health and minimize future occurrences. These adjustments focus on reducing exposure to irritants, boosting the immune system, and maintaining overall well-being. One crucial step is to avoid exposure to smoke, both firsthand and secondhand. Smoke is a major irritant to the respiratory system, triggering inflammation and increased mucus production. If you smoke, quitting is the single most beneficial step you can take for your respiratory health. Maintaining a clean living environment is equally important. Regularly dusting and vacuuming can help to reduce dust mites, pet dander, and other allergens that can contribute to phlegm production. Using air purifiers with HEPA filters can further enhance air quality and minimize exposure to irritants. Adequate sleep is essential for a robust immune system. When we're sleep deprived, our bodies become more susceptible to infections that can lead to phlegm buildup. Aim for 7 to 9 hours of quality sleep each night to support your body's natural defenses. Section 9. When to seek professional help. While natural remedies and lifestyle adjustments can effectively manage phlegm in many cases, it's crucial to recognize when professional medical advice is necessary. Certain red flags indicate a potentially more serious underlying condition requiring prompt attention. If your phlegm persists for an extended period, particularly if it's accompanied by other symptoms like fever, chills, shortness of breath, or chest pain, consult with your doctor. These symptoms could indicate a bacterial infection requiring antibiotics or other medical interventions. Similarly, if you experience difficulty breathing, wheezing, or a persistent cough that worsens at night or with activity, seek medical attention immediately. These symptoms could indicate asthma, bronchitis, or other respiratory conditions requiring specialized treatment. Remember, self-treating serious medical conditions can be dangerous. If you have any concerns about your respiratory health, don't hesitate to seek professional medical advice. Early diagnosis and treatment can significantly improve outcomes and prevent complications. Section 10. Breathe easy. Maintaining respiratory wellness. Maintaining optimal respiratory health is an ongoing endeavor that involves a multifaceted approach encompassing healthy habits, preventative measures, and prompt attention to any emerging issues. By incorporating these strategies into our daily lives, we can breathe easier, literally and figuratively. Prioritizing a nutrient-rich diet abundant in fruits, vegetables, and whole grains is paramount. These foods provide essential vitamins, minerals, and antioxidants that support immune function and protect against infections that can lead to phlegm buildup. Regular physical activity is another cornerstone of respiratory wellness. Exercise strengthens the respiratory muscles, improves lung capacity, and enhances overall cardiovascular health. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Equally important is managing stress effectively. Chronic stress weakens the immune system, making us more susceptible to infections and other health issues. Explore stress-reducing techniques like meditation, yoga, deep breathing exercises, or spending time in nature. Remember, prioritizing respiratory wellness is an investment in our overall health and well-being.